Good morning, Chair, Board, Chuck Henry, for the record, Director of Sarasota County Health and Human Services. Here this morning for our standard COVID-19 update for the board. As usual, I want to start out by talking about appreciations, and since this is National Volunteer Week, I just want to recognize and appreciate the more than 200 volunteers that have helped us at our vaccine clinics, not only at the mall but in other locations. They've certainly enhanced the staff capabilities, but they've also brought with them a positive attitude and atmosphere to the whole process. As we've gone to the mall this week to recognize volunteers and talk to each of them, this is an example of what we're hearing back from our volunteers. This is from Dr. Hollick, and I think he captures what most of our volunteers say, and that they feel this is a great privilege to be able to come back and volunteer in this capacity for our community. Moving on to the update numbers, cumulative cases for Sarasota County as of yesterday evening, 31,567, 1,326 hospitalizations, 808 deaths, 399 of those linked to elder care facilities. When I look at those numbers, that's about 2,200 more than 2 weeks ago when I was here. When I compare those slides, hospitalizations is an increase of 23, so that has slowed down quite a bit, but still is a concern. Deaths, that's 15 more than we had 2 weeks ago. Looking at our percent positivity, today's rate is at 6.3. That compares with 5.6 last time I was here. And as you recall, in late January, early February, we were down about 3.5%. We believe this is a result of the elongated spring break period we have here in South Florida, with a lot of travel and people coming and going. Last time I was here, I told you I thought that was beginning to stabilize. You see it's crept up a little more, but I still believe it's going to stabilize out and begin to move back down over the next couple of weeks. Certainly I could be wrong, so we'll continue to watch that closely, but that's where we think it's moving. Our 14-day case rate per 100,000 is at 350. That compares with 296 2 weeks ago, so that also reflects that slight continued increase. Then hospitalizations in our acute care for our 4 acute care hospitals is now at 74. That compares with 49 2 weeks ago, so we have seen an increase there. Although that number is not a concern for our 4 hospitals in terms of overall capacity, I will point out that the hospitals are still experiencing their end of the busy season full capacity. As an example, Sarasota Memorial, that has 839 bed capacity, staffing capacity right now. Their census was 766 yesterday. So only about 75 empty beds in that huge hospital. Only 54 of those were COVID related. So that's not due to COVID, but when you combine that with overall capacity, it's something we're watching very closely so that we can assist if needed. 13 of those 74 were ICU patients across our acute care hospitals, and that number remains low, and that I think is a direct result of the ability of our hospitals and providers to treat COVID out of the hospital and to move people in and out of the hospital more quickly. So the tools they have are working better in terms of keeping people from ending up in the intensive care unit, and that's really good news for our community. When we move on to vaccinations, our vaccine numbers continue to look really strong. We're at 225,185 yesterday. If you recall, when I was here 2 weeks ago, I mentioned I think our target goal is to get at least 300,000 vaccines into arms. In fact, I say 300K by Independence Day. That's the mantra on where we're going. That's an increase of 28,000 vaccines since last time I was here over the 2-week period, so that continues to be a strong number for our community. Our first dose numbers actually are slightly less. That's individuals that have first dose only. whereas our completed vaccine series continues to climb. It's about 32,000 more than last time I was here. And so that just shows the transition, that the number of new vaccines is starting to slow, but we're catching up on completing the series on everyone that started it. And as you know, we're using a Moderna product, so that's a 4-week period there. Percent of population vaccinated, we're now at 51% of our overall population number. Of interest might be if I take out those under 16, because and I only look at of the eligible population 16 and over, we're at 58% of our total population. We continue to work on that, especially our 40 and unders. They're newly eligible, so it's not that they don't want to get vaccinated. They've only had a few weeks to go at this as compared with Christmas time for those 65 and above. So we continue to work on opportunities to reach that group and improve our vaccine numbers. Our 50 and over population is now at 74%, and 65 and above is at 86%. So again, looking really strong there. Oops. Okay. Variant data that I've been reporting on, just to continue that trend, we're at 6,111 cases statewide, 55 of those in Sarasota County. That compares with 23 2 weeks ago, last time I was here. So we continue to see new cases in Sarasota County. And as I've always said, these cases reflect what we call passive surveillance, so not every case gets checked for variants. So there's probably more out there than that. Most importantly, all of the data so far on variants shows that our vaccines continue to be effective against variants, and we're not seeing that variants are causing necessarily more illness or more hospitalization in our community than we're seeing from other non-variant cases. So we'll continue to monitor that and see where it's at. These are statewide numbers for hospitalizations related to variants, 152 of those statewide, 41 deaths. The majority of the cases are the UK variant. You can see the California variants continue to grow in numbers that were newly introduced just a few weeks ago. Brazilian variant is present, 176 cases, and very few statewide South African variants. Here in Sarasota County, we have only seen the UK and the California variants. That's the only two variants we've seen in our county so far. So where are we going with vaccine distribution from here? As you know, last time we talked about the registration system transitioning away from that process and beginning to have walk-up clinics at the mall, which we've now been doing for about a week and a few days, and so that process continues on. We have 2 spaces at the mall. One is open for walk-ups Monday, Wednesday, Friday, and Saturday from 8:30 to 3:30, and Tuesdays and Thursdays from 10:30 to 6 p.m. For anybody that needs a vaccine, just to walk in and get it. That's a pretty streamlined process. There's rarely big lines. We also have our second dose clinic that continues to run because, again, we're on that 4-week cycle, so we continue to see 1,500 to 2,000 second doses come due every day that we're moving through that second dose clinic. We continue efforts to reach out to minority populations and continue to forge new partnerships to understand where there are individuals that we've not been able to reach with vaccines. We're continuing outreach to large employers, colleges, churches, our medical providers that want vaccine transferred to them. I now have vaccine that I can do that with available, so those that haven't been able to get it directly from the federal government or the state, I can probably help them out by transferring vaccine, and they help me out by vaccinating their clients and staff. We're also beginning to reach out to community organizations, many of which wanted us to come months ago, some of which now say, well, I think most people have been vaccinated. So we're calling all of them and vetting out which ones still have believe they have enough people to make it worth our while to go partner with them, and we'll be doing those over the next few weeks. And then that last bullet is a new one, and actually this is the first public announcement of this because it just came together last minute. We've been trying to get Pfizer vaccine available for our 16 to 17-year-olds. So we'll be holding a pod at the mall clinic this Saturday for 16 and 17-year-olds. We're asking people to contact the health department COVID hotline number 861-2883 to register for that. We will accept walk-ups, but with Pfizer, because of its delicate nature and the fact that once it's unfrozen, we have to use it within a certain time, very fast time frame. We don't want to unfreeze 500 doses and have 200 people show up, and then have 4 days to find placement for the other doses. So we're asking people to register. That'll really help us know how much vaccine to be prepared for. We'll have a little bit extra. But this is an opportunity for those 16 and 17-year-olds that need Pfizer. That's the only vaccine right now that's authorized for use in those less than 18.
Chuck, let me ask you this. Have you gotten this information for distribution through the school district?
They know we're working on it. When I leave here, we'll be calling the school district and asking them to get that out through Connect Ed to all the high schools. We also have a list of about 135 that either registered in our registry system or that called the health department already, which is the process we had put in place until we were able to get Pfizer. And so we'll be contacting those 135 families to make sure they're aware that it's now available.
And the last leg of that is, and I'm not talking about the virtual enrolled students, we have a decent-sized population of parents that homeschool their children, and they have sort of some organizations. Can you reach out to them also?
We will do our best to reach all of the organizations that work with
Sure.
that age children. And I think as the summer moves on, we're anticipating Pfizer for sure, probably gaining approval for 12 and above next, and then Moderna and Pfizer are both working on processes that seem to be going well for age 6 and above. So I think by the end of the summer, we'll probably be able to push vaccines out to most children. We just don't have that authorization from the FDA yet below that 16 and 17-year-old group.
Okay.
Key messages continue to be, and I know this is probably like a broken record, but we continue to push everyone to get vaccinated. Whether you think you should do it or not, we encourage you to do it. It's going to help our community stay stronger. Our community's done really, really well through this pandemic. We ask people to continue social distancing and wearing masks when you're in that, what I call mixed company. If you're in a public area where you don't know that everybody that's with you has been vaccinated, then it's prudent to do that. Continue to wash hands frequently and vigorously, and staying home when we're sick. Those are the things that have really kept our community safe through this last year, and we ask people to continue that. I'm hoping by July, if we reach that 300 vaccinated number, that our positivity rates and our case rates will drop low enough that we will enter that period, that area that we call low transmission, and then we can relax a little bit. But now is, from my perspective, now is not the time to relax. We need to continue this. I think we're going to beat it, but relaxing now may prolong how long it takes us to get to end game. So I'm encouraging everyone to continue doing all those things so we can get there sooner rather than later.
We have Commissioner Dietert are you on the board.
Yes. Quick question. What are we doing? I think it's great that you're doing this on Saturday for teens. What are you doing to publicize that would be question number one. And question number two is, is it too unwieldy for you to go to schools and just do them in the auditorium and do anybody in the school that wants to be vaccinated, or do they have to have a parental permission slip? Or
They do have to have parental permission, and preferably parents signing the consent form there with them. We could, as we have done with flu shots in the past, go through a process to send those consent forms out, get authorization, bring them back. But right now with the Pfizer vaccine, I don't have that. So the reason this is coming up rather quick is we were able to acquire some Pfizer vaccine for an event with Ringling College, and there'll be some additional left over that we want to utilize for our 16 and 17-year-olds. So this is just coming together yesterday and being announced today because we want to get it out there. It's not impossible for us to do that, but in the small numbers, when we're trying to manage maximum doses for each vial and not waste any vaccine, it becomes challenging to do in the school setting right now.
Commissioner Moran and then Commissioner Cutzinger.
Chuck, every opportunity I get, I just want to say thank you for everything you do, just genuinely, and I think this board feels the same way. We just appreciate you a ton. I think the very first time, literally well over a year ago now, the first time you stood before us at that microphone talking about COVID, I asked the question, we asked the question is keep your eye open for what the definition of success is for this. Whether it's a number of deaths in a certain period or a percentage of folks being vaccinated, some type of definition. You know, your average hardworking taxpayer, I think, is starting to get very interested in what the conclusion is going to look like on this. Have you heard any communication, maybe subcommittees at the CDC level, work groups? Is anybody talking about definitionally what this would look like at the end for success?
I do not have anything that I'm aware of that's been published that says when we get to this point on these 2 or 3 measures, we're there. I think there's a lot of unknowns yet on where the case rates will go, what the variants will mean or not mean, whether or not we'll actually achieve significant vaccine rates across the nation. I think we will here in our community. We're well on our way to that, but I read quite a bit in the paper about people that are resistant to getting vaccines, and that's certainly a position that individuals can take, but I think it prolongs just the nature of the way this illness moves, prolongs the numbers that we on the public health side watch. You know, what is our case rate per 100,000 or our case rate per 10,000? What is the percent positivity rate? So we're looking for indications on what is the level of transmission in our community, and when is that risk low enough that we can begin to return to some form of normal, whatever that new normal looks like.
Yeah, and I think it's just an intellectually honest question and discussion for everybody to start having is without those definitional conversations, it feels endless. And I think people just want answers in that. Again, if you can see what the end looks like, people will be more patient and hopeful and do what's asked or not demanded, but asked of them. But again, without that, I think it feels endless. So any voice you have, any ability to bring that forward to folks that have legislative decision-making ability in that, please carry it forward for at least me, for sure. Thank you, Chuck. Again, I appreciate everything you do.
Okay, Commissioner Petzinger.
Yeah, thank you, Chuck. I know you had discussed the possibility of a clinic in Inglewood. At that point, it was going to be a Johnson & Johnson, and then I think right then is when they came out and decided to halt. So I'm guessing that did not go forward, and I'm wondering, are we going to move forward but use maybe Moderna or even Pfizer, do something like that geographically now that we have the vaccine?
Yeah, we actually did have that clinic. It did move forward as scheduled. We did switch over to Moderna last minute. That pause came 2 days before that clinic was scheduled and after we had already rostered everybody for J&J. So it wasn't as well attended as would have liked because some people really wanted the Johnson & Johnson product. But we did have the clinic. We vaccinated, I don't remember the exact number, it's about 120 individuals, including a number of homeless individuals that are campers that were affiliated with that church. And so we'll be going back for second dose, I believe, on May the 12th for that, and we'll continue to schedule more.
Okay.
On the Johnson & Johnson, all indications are that the FDA will be looking at that again on Friday, and most people believe that they're probably going to reauthorize its use with some additional warnings for providers and outline some of those risks as they do with many medications so that everyone's aware of them.
Okay. Thank you.
Okay, anything else, Chuck?
That's all I have for you today, unless there's more questions.
Thank you so much, buddy. Great job.